I'm a strong supporter of the Bulletproof Vest Partnership Program. These vests saves lives. I'll give an example. Fairmont, Minnesota is a relatively small town of about 10,000 people just north of the Iowa border. It's a tight-knit community. On October 26, 2010, Fairmont police officer Chad Sanow finished dinner with his wife and kids and then left for work. Shortly thereafter, he responded to a call for a fire, about a house fire. It turned out to be an ambush. A gunman was hiding among the flames. Officer Sanow was shot in the chest. During the encounter, two amazing things happened next. First, Officer Sanow received a call from his wife, and in the midst of the chaos, he answered the phone. He later said, "I knew I shouldn't have answered it, but I didn't know how bad my injuries were, and I wanted to talk to her because what if I didn't make it? And I wanted to hear her voice." The other amazing thing was Officer Sanow survived. He was wearing a bulletproof vest that the Fairmont Police Department had obtained through the BVP program. Otherwise, he would have died. His lieutenant later said that the bulletproof vest absolutely saved Sanow's life. Officer Sanow walked away with just a deep purple bruise on his chest, and that's what this program is all about. Last year, about 180 towns in Minnesota acquired more than 2,500 bulletproof vests through the BVP program. But when I think of the BVP program, I don't think of statistics. I think about this story. I think of people like Officer Sanow. Not long after the shooting, Officer Sanow said that he wears his bulletproof vest for his family because every night I want to be able to tuck my kids into bed. I think you said that, something very similar, Officer Canterbury. And he said, "I want to share that meal at supper." Officer Sanow has been keeping his community safe for more than 15 years, and we're blessed that he's still with us and serving the people of Fairmont. Mr. Canterbury, you brought up the issue of wearability. And I think this is an interesting issue, which is that at a certain point, you reach a point of diminishing returns. As you're saying, you can create something thick enough to stop anything. But it is really important that these things be comfortable enough that it doesn't incentivize not wearing it, right?
Yes, sir, absolutely, especially in high humidity situations, temperatures that you have in Phoenix every day in the summer. The comfort, wearability are essential. I mean, they could be dangerous at some point with those kind of high temperature situations if you didn't have the NIJ testing and other ways for officers to, in those agencies, I believe the over-the-shirt vests work very well because at least when they're in their car, they can loosen them, get air under them. When you're wearing that under your shirt and over a T-shirt and many times another shirt to keep it off your skin, it makes it very difficult. So the industry has done well to come up with new ways.
So when assessing the effectiveness of it, that wearability issue is actually an issue because
yes, sir,
it's counterproductive if you don't wear it.
Absolutely.
Last week I introduced the Local Courthouse Safety Act to codify Justice Department's Valor Initiative, which provides training and technical assistance to local law enforcement personnel and teaching them how to anticipate and prevent violent incidents. For example, the Valor Initiative teaches officers how to detect concealed weapons and to identify potential gunmen. Mr. Canterbury, I understand you've served as a training division supervisor with your police force. Do you agree that training is an important component of officer safety?
The most essential part of officer safety, and unfortunately it's first thing cut when money gets tight. So without programs like VBP, the next thing that's going to be cut is officer training. It's the first and easiest thing to stop in a budget.
And you talked about those critical opening moments of an incident. This is one of the reasons I support the Mentally Ill Offender Treatment and Crime Reduction Act. You're familiar with that. People with mental illnesses are disproportionately caught up in the criminal justice system, and encounters with this population present a unique set of challenges for police. The Mentally Ill Offender Treatment and Crime Reduction Act helps local police develop models for responding to incidents involving the mentally ill. Mr. Sherling, do you agree that specialized training for police can reduce injuries to not just the officers but civilians during encounters with mentally ill individuals, and can you speak to the importance of that program?
I do believe that's true, Senator, and I think that's an excellent topic for discussion here in 2012. One of the most challenging things that our officers face day to day is events in which people with unmet needs in the realm of mental health are acting out in some fashion. And as state budgets continue to be reduced, services and programs for folks that suffer from mental illness are eroding, and when all else fails, the last resort is the 3-digit phone number. It's 911. And the situations can be very unpredictable, and they can be very challenging to deal with. And we're spending a great deal of effort training law enforcement and building additional capacity through street outreach interventionists, working with law enforcement agencies and things of that nature to try to ensure that we can de-escalate those scenarios before a bulletproof vest becomes the last line of defense, or vice versa, that someone with a mental illness who is there not for their own choosing ends up injured or worse as a result of an encounter with law enforcement. So it's a huge challenge in an area where we need to spend significant focus.
Thank you. Thank you all for your testimony and for your work. Thank you. Thank you, Mr. Chairman.